Welcome back to Functional Wellness with Dr. Allison, medicine for the body, heart, and soul. I'm Dr. Allison, and today we're kicking off a brand new series that I'm genuinely excited to bring you about perimenopause. And I know, there's so much information out there, we don't even know where to start. But here's the thing. I've watched so many women walk into my office, they feel like they're losing their mind. They can't sleep. Their brain is foggy, their periods have gone rogue, and when they go to the doctor, they're told that this is just part of getting older, or worse, they're handed a dementia screening test because their brain fog's so severe, but that's not getting them any answers or support either. And this is why we're going to jump into this series. So over the next several weeks, I'm going to bring you deep dives into sleep, weight changes, anxiety, nervous system support, brain health, and even ADHD and perimenopause. So we'll have interviews with other experts, and I'm going to give you practical, evidence-based tools that you can actually use starting right now to help you through this transition. But today, we're going to start with laying the foundation, everything that you need to know about what perimenopause actually is, why it seems to be starting earlier and earlier for so many women, what testing can and cannot tell us, and most importantly, what you can do right now to support your body during this shift. So let's dive in. So first, let's define our terms. What exactly is perimenopause? Perimenopause is the transitional phase when your ovaries start to slow down hormone production and your adrenal glands begin taking over some of that production, but at a much lower rate. So ovulation becomes sporadic, irregular too, until it completely stops. And then once you've gone 12 consecutive months without a period, you're officially considered in menopause. Now, when I was in school, we were taught that perimenopause lasted about 5 years, typically like 48 to 52. That was considered the standard timeline. But what I'm seeing now, and probably what you are too, is that perimenopause is now lasting 10 years or more for many women. The timelines we learned were either simply outdated or misunderstood. Symptoms like brain fog, anxiety were labeled as that and not part of perimenopause. So what does it actually feel like? I think most women notice the subtle symptoms first, like the insomnia that seems to come out of nowhere, itchy ears, brain fog, and they know something's really off, but they can't quite name it. But they're still getting their periods, so they don't think it's perimenopause. Then we go into the obvious changes, like hot flashes that wake you up drenched in sweat, periods that come at the worst possible times, or like every 2 weeks. Maybe your periods are lasting longer or getting heavier, and you might go a few months without your period and think, this is it, I'm done. But then it comes back and you have to start the whole 12-month process wait again. Other symptoms include mood swings, anxiety, weight gain, especially around the middle, joint pain is huge, changes in libido, vaginal dryness, and that crushing fatigue that makes you feel like you're moving through water. Now here's the million-dollar question. Why are we seeing women enter perimenopause earlier than previous generations? So first, let's acknowledge that we don't have a complete scientific explanation for even why menopause happens at all. There's some anthropological theories about the evolutionary advantage of older women caring for community children, shifting focus from reproduction to nurturing. We know that egg quality declines with age, and the ability to have a healthy pregnancy becomes harder after 40. It's still possible, but there's likely a protective factor there. What I've been seeing clinically in my practice, what the research is starting to support, is something I call viral-induced perimenopause. The stress of a viral infection, particularly COVID or Epstein-Barr, can cause a significant shift in immune function. And sometimes that shift triggers autoimmunity, mast cell activation syndrome, and then a cascade that affects hormone production that can push women into perimenopause earlier than expected. So research published in the Women's Health and the Journal of Clinical Medicine has documented cases of menstrual cycle changes earlier and early ovarian insufficiency following COVID. We're seeing inflammation at the level of the hypothalamus and pituitary. Those are the brain centers that direct hormone production for the whole body, and that disrupts the whole hormonal axis from top down. We know that women who've had hysterectomies, even with ovarian retention, are more likely to enter perimenopause about 4 years earlier due to the loss of blood flow and arterial supply to the area, and that's well documented. We know that. And I absolutely believe that chronic stress, possibly unresolved trauma, or the trauma that inflammation creates is specifically neuroinflammation affecting the brain again, and it can interfere with hormone signaling, adrenal health, and that's a real and powerful connection there. And then we have the big question about testing, because this is the question every woman wants answered. Can't you just run some labs, tell me what's wrong, tell me what I need, and then we'll fix it from there? And I wish it was that simple, because your doctor doesn't often want to run hormone testing for perimenopause, and there's actually a really good reason for that. They're not trying to trick you. They're not trying to get around insurance. They're not really trying to ignore you, but your hormones are fluctuating dramatically from day to day, sometimes even hour to hour during perimenopause. So blood tests at one point and one time is not going to give us the reliable information that we need. And it's so frustrating, I know, but it's the reality. The lab ranges we use are incredibly wide because they have to account for the follicular phase, the first half of your cycle, into the luteal phase, the second half of your cycle, when your hormones are completely different. And most women don't even have a baseline of hormones before they even get started, so there's nothing to compare against. So even if we run blood work and find that your hormones are off or there's something maybe not quite right, that standard approach or lab ranges doesn't often go too far. And then the answers are typically just birth control pills, maybe to stabilize hormones until maybe you're 55 or older, hoping that you'll be in menopause once you get off of them. And now we have this growing ability to get hormone replacement therapy in a lot of different places, which is fantastic. So I'm really grateful for that. And there's also some newer medications on the market specifically for hot flash suppression, but overall we're stuck in this uncomfortable middle ground where women desperately need support, but there's not a lot in conventional medicine that we have to offer. Now, what I will say is that there's the Dutch test and also saliva testing that we can do to monitor your hormones. And these labs will offer a perimenopausal pattern where you're actually doing 3 days of testing spread apart, so that way we're tracking the entirety of what's happening over a few days or even the month, because we're going to see those hormone fluctuations a little bit more closely, see those patterns, and where you may actually be having some trouble or clearance or genetic issues coming in as well. So women come in often complaining of brain fog and the crushing fatigue. They can't think straight or remember words. And even the only tools that we have is to run a dementia screening test, which we pass because it's not dementia, it's perimenopause. So really we're even just waiting for cognitive decline to become so severe and then address it, which is just a horrible system. So we're going to talk about a functional approach to how this can help you. So in my practice, I will run blood work. We can use insurance, or I have a cash co-op through Quest that gets labs at a really discounted price. So that way you don't have to worry about deductibles and things like that. We're looking at FSH and LH specifically. These are the 2 hormones that stimulate ovulation. And as you enter perimenopause, these hormones start to increase. They get louder, like the brain is screaming because the ovaries aren't responding or ovulating. So these hormones are typically low throughout most of your cycle, except for the days leading up to ovulation. So we try to do labs on day 3 or 21 of your cycle, so FSH will be a little bit lower. Now, if I see it at 16 or 20 and you know you're not ovulating, you're probably moving into perimenopause. So that's what's interesting about it, is that some women who think they're in perimenopause are actually having perfectly normal hormone levels in FSH and LH. So that means your symptoms are coming from somewhere else, and it's time to dig deeper, because it's easier to blame perimenopause than it is to check thyroid function. We need to check autoimmune markers. We need to check inflammation markers like CRP, iron, and ferritin levels, because low ferritin alone can cause crushing fatigue, hair loss, and brain fog. All of these things that can mimic perimenopause. And this is critical because we need to run these viral and immune labs to rule out Epstein-Barr virus, long COVID issues. And according to research in Frontiers in Immunology and Clinical Infectious Diseases, Epstein-Barr reactivation can cause symptoms identical to perimenopause, like brain fog, mood changes, fatigue, and these viruses mimic hormonal shifts. If we don't catch them, we're treating the wrong problem. Which is why a lot of the hormone work that you're doing and the diet changes and everything else aren't working, because there's still something underlying. So when we talk about a whole body approach, we talk about how we can support this foundation. And like I said, over the next few weeks, we're going to do deep dives into specific topics like sleep and anxiety and nervous system regulation. But today I wanted to give you my foundational support protocol and explain why I use it. So when we talk about perimenopause, we really need to look at the whole body, not just hormones, not just ovaries, not just periods. And it's tempting to think that getting on HRT will fix everything. And a lot of times it does, and I have nothing against it. But if your body systems aren't set up for success, HRT might not be as helpful as it could be, or it might make you feel worse. So what systems do we need to support? First is the brain. The hypothalamus and pituitary are directing these hormone changes to the ovaries and the adrenals. So if there's inflammation, dysfunction, autoimmunity, the whole system is going to suffer. Next, we need to look at the adrenals, because they're taking over hormone production from the ovaries. And honestly, who hasn't had chronic stress by the time that they hit 45 or even 40? So we're already having these issues with improper cortisol release, adrenal fatigue, and we need to start there as well. The ovaries still need support, so they can either keep cycling properly or transition smoothly into stopping. And this is where a lot of symptoms come in, because the ovaries are confused, for lack of better words. So they're throwing out eggs or not, and we need to really get them under control. The liver is the next place I like to look, because the liver is processing hormones and packaging them into the bile for elimination. So if your liver is congested or sluggish, hormones aren't being cleared properly. You have poor detoxification phases because you don't have the micronutrients needed for the liver support. Next, we look at the gut. So if you have a leaky gut, poor bacterial balance, or inflammation, those toxins and hormones get recycled back into the bloodstream instead of being eliminated. This is called enterohepatic recirculation, entero meaning gut, and hepatic meaning liver. So it's a huge driver of hormonal imbalances, and taking hormones isn't going to fix that leaky gut issue. Next is blood sugar imbalances, which is why you're seeing such a huge protein push right now, because when blood sugar is unstable, we're skipping meals, we're fasting, we're just having coffee for breakfast, we're in a rush, we're eating so much restaurant or drive-through food, we're waiting to eat until we're hangry. The whole system breaks down. It creates so much inflammation, loss of cognitive function, and it worsens hormonal symptoms. So this is why I've created a foundational protocol that's safe for everybody across the board, because it's really, really simple. I can't tell you how many times a woman has told me that her period is stopping and starting unpredictably. She feels like she's losing her mind. Her energy is completely tanked, and she's trying to mask it. She's trying to say, I'm fine, but secretly like whispering to me in the corners of rooms. So then what I do is I give her my protocol. And within a month or two, she's pulling me aside again at the next meeting saying her cycles are back to normal. And then some people have told me that they've stopped cycling and they feel so much better. So here's where I start. First with Clary Calm Essential Oil Blend. This blend works on all the organ systems I just mentioned, the brain, the thyroid, the ovaries, and the adrenals. It supports healthy hormone communication throughout the entire system. And it's marketed for supporting pain during periods, but when we use it daily, it creates open communication from the brain down through these hormonal axes. I've even had women tell me that their body skipped ovulation. They swiped some Clary Calm in, and the next day they ovulated. So the more consistent you are with this, the better results you're going to see. So keep it in your bathroom or on your nightstand. Use it morning and night. Just swipe it across your lower belly and be consistent. The next thing I'd like to talk about is Revitazen, because it supports the daily detoxification system, specifically liver phase conjugation, kidney clearance, and the large and small intestines. This clearance is meaningful because full hormone cycling and proper elimination. So we're going to feel better because our hormones are moving through us. It also reduces opportunistic bacteria in your gut, and it's really just like a gentle reset for all your systems. Next, I recommend adding in PB Restore as a probiotic to rebuild a healthier bacterial balance. This includes prebiotics and postbiotics so the bacteria continue to be fed and supported. It includes bacteriophages, which help remove unwanted bacteria as well. So once we have that healthy microbiome, which is so important for metabolism for the hormones, that recirculation is going to stop. Things are going to be moving smoother. Your gut's going to feel a lot better. Now, fiber is a must-have, and I know that annoys a lot of people, but it really grabs on to what the bile is moving through our stool. So some women do well with fiber, others do well with binders like activated charcoal, fulvic acid, or arrowroot powder, and it really just depends. So work on whatever works best for your digestive system. I would say between the Revitazen, the fiber, or the charcoal, I've seen a lot of women get rid of hot flashes this way as well. So it's so key and it's so simple. And then we talk about blood sugar regulation with the MetaPower Assist. Now, this has herbs that help improve insulin resistance and insulin signaling as well. It works on cellular health for energy and mood. Blood sugar stability, like we talked about, is foundational for everything else because you can take HRT, you can take estrogen patches or get testosterone pellets, but if your blood sugar is off, you're still going to be cranky, you're still going to be hangry, you're still not going to feel good. So this is why it's the best simple foundational protocol. I'll drop it in the show notes for you so you don't have to go chasing 1,000 supplements, different programs, diets, workout plans. We want to start simple and slow and get you the support that you need and then build on whatever is left over so that way you have the foundation, and I love the simplicity of it. So what's coming up next in our series? Next week we'll be interviewing nurse coach Jen, who's an amazing expert on perimenopause and also how to feel your best with simple, sustainable support. And a sneak preview, we're going to be offering a program together where you can work with both of us, get your labs, get 90 days of care as well, and get the supplement protocol. So over the next few weeks, we're going to be covering deeper functional medicine support for perimenopause, sleep optimization, especially if you're waking up at 3 o'clock in the morning, weight and metabolism, brain health and cognitive function, ADHD and neurodivergence in perimenopause, libido and intimacy interviews with experts in hormone therapy, nutrition, and nervous system regulation as well. So each episode will give you practical tools, evidence-based information, and real talk about what this transition looks like. And I think I also want to include some energetic work as well that you can build your energy up through different practices too. So I want to close with this. Perimenopause is a natural transition. It doesn't mean that you have to suffer through it though. You deserve the support, the answers, and feel like yourself again. So if you're experiencing symptoms and your doctor's dismissed you or told you just wait it out, I want you to know that there's a ton of options. Functional medicine offers a different approach, one that looks at not only just root causes, but the entire foundation of your body to help you through this transition. So you can find more resources, book a consult, or join our email list at littleblackbagmedicine.com. I have the foundational protocol that I linked in the show notes for you here. And thank you so much for being here, prioritizing your health, learning, expanding your knowledge, and I can't wait to walk through this series with you. Until next time, make sure you like and share and follow along. Take care of your body, heart, and soul, and we'll see you soon.